The opioid crisis continues to hold a firm and fatal grasp on the state of Illinois. According to the CDC, overdose deaths rose by 10% over the last year. But experts and patients alike believe it can be stopped by rolling up something still taboo here in our country. I took a look at what some are calling a marijuana miracle. Pill by pill.
Steroids, prednisone is in here.
Bottle after bottle.
For a lot of us with chronic conditions, addiction to opioids is the natural process.
With rare, debilitating pain, Sarah Brannon saw painkillers as the only way to get by.
And when you're in chronic, debilitating, 24/7 pain, you have no other options. So you're taking pills every 4 to 6 hours because otherwise you're crying in bed in a ball.
She says that all stopped with the power of a controversial plant.
I went from taking basically the pills that an 80-year-old woman would be taking down to one medicine.
From pills to a pen, medical cannabis is the only reason Brannon says she's not still hooked.
It has improved my life more than I ever even knew was possible.
Her story is one of many in Illinois that's driving a push for a medical marijuana expansion in the state.
People don't understand it because they've been told for so long that it's illegal, that you shouldn't use marijuana or as we call it, medical cannabis.
That's Dr. Raul Kari. For years, he's been advocating for marijuana as a safe alternative to prescription opioids like Vicodin.
It's very different than opiates, which actually attach to the receptors of pain and take it away. But the long-term effects of that is that you need more and more of it, and then you become dependent on it. Whereas cannabis doesn't have that dependence, and you can live your life.
Now, Illinois Governor Bruce Rauner, once opposed to legal marijuana in the state, has signed a bill allowing for that medical replacement.
To see him turn around his perspective and agree with the majority of Illinois people in favoring the opioid bill was a huge thing.
Data from the Illinois Department of Health shows more than 1.5 million opioid prescriptions in the state last year. That equates to 1 prescription for every 8 Illinois residents. With numbers like that, experts say that the Illinois cannabis industry could grow.
It's not going to be 1 million people on day one coming in. It'll just be sort of a slow and steady. People will get to know the issue better. They'll get to understand that it's the right medication for them, and then they'll seek the medicine out over time.
Seeing a high rate of success, more than I've ever seen in my career, and it's been, in Illinois making it legal just 3-4 years ago has really improved the quality of lives of thousands of patients.
But the number of doctors signing off on medical marijuana cards for patients is still low. Dr. Kari says it's more than a matter of stigma.
The traditional way we learn about medications is through research, either by the government, NIH, or by pharmaceutical companies. Unfortunately, pharmaceutical companies won't research this because they can't make a profit off of it.
Despite that, hope for the seemingly miraculous drug is still burning high.
My colleagues don't feel comfortable, but as time goes on, as we give more lectures, as the research is coming out, as their patients are telling their physicians how they're reducing their narcotic usage and their benzodiazepam usage, physicians will understand and will relate to it.
We're seeing the benefits of it. We're reading more about it. I don't think it's a one-sided political issue. We see this more as a medication instead of a drug.
And to qualify for medical marijuana in Illinois, you've got to meet with your doctor to determine your symptoms. So head over to the Illinois Department of Public Health website or call the number on your screen for a comprehensive look at the qualifying conditions and how to become a patient.
And Brandon, I have to ask, how does a new governor impact this?
Well, you could say that marijuana won the midterms. J.B. Pritzker now in office, and he said right away he wants to legalize marijuana recreationally. So if he does that, if that's successful, it would open things up more. You heard the doctor talking there about it's tough to regulate marijuana, not a lot of research on it. Well, if it becomes something that's recreational, then there's more research, then a lot more doctors and medical people start being more open to having it as a treatment for their patients. So take a look at that as we get into the coming years.